immunological involvement in CDG. And now I can't seem to move my slide. Okay, now I can. So just a brief moment to acknowledge the fact that we are all CDG virtual coffee pioneers, and to remind you that we are recording this session, which is really meant to be an interactive session. So the main goal of these CDG virtual coffees is really for us to exchange our ideas, knowledge, and learn from each other. So please do ask questions, use the chat, or unmute yourselves. So why are we exploring immunological involvement in CDG? Sugar trees, so glycans, decorate many immune cells and proteins, such as antibodies. And defects in this glycan makeup can lead to altered immune responses, which in turn can be associated with infections, allergies, autoimmune diseases, or altered responses to vaccines. And indeed, a growing body of evidence published in the medical literature has been showing that immunological involvement is a clinical feature present across many different CDG types and patients. And I would just like to bring your attention to a paper that was published in 2019, and which are the international clinical guidelines for the management of PMM2 CDG. So clinical management guidelines basically gather all the existing clinical data available, in this case, on the different clinical manifestations present in PMM2 CDG, in which you can see immunology has been included. Clinical management guidelines also offer recommendations and advice on how to diagnose, monitor, and treat these clinical manifestations. But what's reported and what's gathered here in these clinical management guidelines is really that the main or the most common immunological manifestations present in PMM2 are infections, which can either be recurrent or also severe, but which commonly happen during younger ages. Also, the lack of response to vaccines and some alterations in the blood levels of some immune cells and antibodies has also been reported. So even though we acknowledge the fact that indeed much progress has been made in the field of immunology in CDG, we also felt that there was still significant knowledge gap to fill. That is why we decided to capture the perspective of CDG families on this topic. So how did we do that? Well, actually, we created an electronic questionnaire, which was structured into these following 5 sections that you can see listed here, and then it was disseminated via online using multiple platform strategies. We not only targeted CDG families and patients, but we then adapted our tool and also disseminated it among the general healthy population that we used as a control in our study. So what did we find out with the help of many CDG families? For the sake of time today, we are just going to share with you our top 7 results. And to begin with, our first result was really the high participation and the collaborativeness that CDG families showed, because a total of 209 CDG patients were reported in our study. Among them, 122 had PMM2 CDG. And that's why we then performed a more detailed and statistical analysis for this specific patient group, so for PMM2 CDG. And what did we find out about immune manifestations in these patients? Well, firstly, in our patient cohort, allergies were uncommon. Generally speaking, they were quite uncommon in PMM2 CDG. The only exception were food allergies, which were higher when compared to our control, so to our healthy individuals. Then we really focused on the infection profile and history of these patients. And what families told us was really that about half of all the reported PMM2 CDG patients had experienced relevant infections, with 63% of these being related to the gastrointestinal tract, so GI infections. And actually, families also confirmed what was already reported in the literature, that young ages, in this case, birth to 3 years old, was the time period when these infections had greatest clinical relevance. So They had either been more recurrent, more frequent, or more severe. And this somewhat more busier image that may look a little bit more complicated, but actually the message that we want to convey is really that in our PMM2-CDG patient group, when the patients were reported to have relevant infections, they were also reported to have overall greater phenotypic severity, meaning that the presence of relevant infections also meant that the patients had an overall more severe clinical presentation. And the second thing that we want to highlight with this figure is really that the presence of infection also associated with some gastrointestinal manifestations and with specific neurological signs and symptoms, particularly with seizures and stroke-like episodes. Then we also inquired families about the impact of these immune-related manifestations on their quality of life. And both allergies and infections were described to have a negative impact on the patient's quality of life, but particularly infections, and particularly which had a particularly negative impact on the patient's daily lives, so daily tasks, daily routine, the ability of the patient to go to school, for example, or to eat. Our seventh and last result for today is related to vaccinations. So the wide majority of PMM2-CDG were reported to be vaccinated and to comply with all the recommended vaccines, but also they were reported to have more severe adverse reactions to vaccines, including generalized infections, and seizures and stroke flags were also reported by the families to associate with vaccines. So to conclude our results, basically our first great finding was really that CDG families are amazing research partners, highly committed, and that with their knowledge and their input, we could not only confirm data that was already published in the medical literature, but they help us discover novel aspects related to immunological involvement in CDG. And perhaps the most relevant really is the possible interplay that our study suggested between the gastrointestinal tract and the immune system in PMM2-CDG. Of course, now this warrants further investigation. Specifically, we suggested that studies on these patients' microbiomes could be performed, and maybe that could help us understand better this possible connection. And then something that I really didn't go into detail today, but our study also raised some red flags regarding the management and follow-up of immune-related manifestations in these patients, because there were some discrepancies in terms of the tests that the families reported that their children did, but also regarding the frequency of the testing. And we do believe that an improved family clinician communication can greatly also ameliorate or improve this. So just to kick off our Q&A session, which is the main goal of today's CDG Virtual Coffee, I would just like again to bring back the guidelines, the clinical management guidelines for PMM2-CDG, because if you remember, I told you that also these clinical management guidelines offer recommendation and advice on how to diagnose, monitor, and treat specific clinical manifestations. And in the case of immunological involvement in CDG, these are the immune parameters that are recommended that patients test or are tested for these parameters, namely to measure the blood levels of white blood cells, so immune cells, and also the levels of immunoglobulins, that is antibodies. Both, so all of these parameters, the cells and proteins, can be measured with specific blood tests that can be done, that should be done periodically, or in the case of recurrent infections in these patients. And also the guidelines mention the need to monitor the response to vaccines, so to determine if the patient following a vaccination produces protective antibodies. But very importantly, also the guidelines mention that generally, so as a rule, all PMM2-CDG patients should be vaccinated unless there is very clear medical evidence that they shouldn't. And actually, our results, so our study showed that PMM2-CDG patients are being vaccinated, so that's good. And finally, regarding the treatment of immune-related manifestations for PMM2, the advice that's present in the clinical management guidelines is mostly related to infection management, which also mainly relies on appropriate antibiotic administration. But also, again, we need to stress that each patient is a patient, and every single clinical decision making needs to be done in close collaboration with the attending clinician or with the medical team following the patient. So now it's really to conclude. I'm going to be quiet, be silent in a moment, but just to let you know that now we also have clinical management guidelines for other CDGs. So for MPI CDG and PGM1 CDG, and others are in the making. So these are really important documents, not only to physicians, researchers, but also to families. They are a guarantor that every single patient is receiving the best care possible, at least as at the moment, with all the knowledge and tools that we currently have. But we also think that they are a useful tool to improve the communication and the collaborative efforts between CDG families, patients, and also with their clinicians and researchers. So I thank you for your attention, and I open the floor for discussion.
Thank you very much. Thank you very much, Rita. May I maybe start with antibody measurement after vaccination? Should it be necessary to repeat the measurement of antibodies also after the second or the third vaccination when you have good levels after the first vaccination?
That's a great question. Maybe we can include other clinicians here today if you share their opinion.
Maybe I will add another question to this one, from this great question from Professor Jack. So in the questionnaire, we were not addressing the antibody titers after first or second immunization, no. Right?
No, just generally. We just asked families if they monitored, yes, vaccination response.
But I would assume it will be after complete vaccination, right? The vaccination schedule.
Okay.
Yes.
Sorry.
I know we received some questions in advance. I don't know if anyone from the team also would like to share those, because we received quite a lot of questions from CDG families who I guess are a bit shy today here, but maybe we could also try to answer some of those questions.
Hi, my mother.
Hi, Aaron. How are you?
Hello, Aaron.
I wanted to ask if we just got in, so we missed all of the beginning part. But if you find you give the CDG person a vaccination and then you check it and see that it hasn't developed antibodies or whatever it is we're looking for, what do you do then? Go get another vaccination, or just be aware that you're not immune?
If the levels are not sufficient, you mean, after the first?
Yes. If it shows up that you.
Yeah, I would repeat it. Yeah.
Yeah.
Oh, really? Okay, so there might be a chance that the second time would work.
Yeah, maybe.
Okay, good, thanks.
Oh.
We're done.
Also regarding that question, I can add on that, because we received a previous question from a family, which also asks that if there are any problems of CDG patients responding to vaccines, so adverse reaction, and you already said that that there was for some patients, but there's a specific question if they should be always vaccinated for all types of vaccines, either with living virus or dead virus. I don't know if you have anything to add on that.
Yes, in principle, yes. I would give them all vaccinations if they are, of course, I would say in a normal condition. But yeah, if they are severely ill, then I would postpone it. I don't know, Paula, what you would think about this.
I think it's depends on the whether these vaccines are live, attenuated, right? Where there are more risk, but according to the guidelines and which implicated a revision of the data and the literature, it was not clear that there was adverse effects, right, or a risk for any potentially infection with the vaccines. So it seems they are apparently safe,
Yeah.
unless there is no. But depends on the types of CDG, obviously. Right?
Yeah.
Julie is saying also that she has questions from the UK. So because I already, oh wait, maybe we have some before. If I can start on the beginning. So is there any CDG that presents less immunological resistance? That's the first question.
Yeah, Paula?
Well, there are some CDGs with the major affectation of the immune response. We have that on our revision of literature. Maybe Rita can also add here what are those. But that means that the definition we put this category of diseases was that all the patients that were included had immunological affectation. It was not in the sense of severity, but also if all the patients reported had immune manifestations. But for instance, the FUT8 CTGs was one with very prominent immunological affectation, and there were others. Maybe Rita, you have there the list. So the PMM2 was considered as a minor involvement, although there are several reports where or a good number of patients with immunological affectation.
Yeah, I mean, I think it's a difficult question to answer. Also, in terms of understanding what decreased immune resistance means, because that is a very unspecific designation. But yes, there are some CDG types that are mostly characterized by their immunological involvement, so such as MOX CDG or PGM3 CDG, or a recently described CDG type that's called MAN2B2 CDG, which is actually an immunodeficiency or presents mostly as an immunodeficiency. But it's really variable in some CDG types. Some patients do present a degree of immunological involvement, while others seem to not to have any immune-related problems or manifestations or dysfunctions whatsoever. I don't know, Professor, if you want to add to that.
No, not specifically. Sorry.
Carlotta, I don't know if you can share more questions.
So, yeah, I will proceed. So this is a very general question because it's also not really specific for CDG. But people are asking if there is like some kind of food supplement or therapy that could be used to boost immunity.
Well, I mean, that's again very difficult advice. I think the only thing I could share is that really for a CDG type that's called SLC35C1 CDG, which also mainly presents as an immune deficiency, the supplementation with sugar called fructose has shown to be beneficial and to improve the immunological function in these patients. But more medical advice I wouldn't dare to give. I don't know if any doctor in the room would like to share some insights on that.
And also on your on this questionnaire, it was not. There was also the question whether the therapeutics could improve the or overcome the immunological dysfunction, and the results were not very clear, right, Rita?
Yes, firstly, not many, only very few participants reported ever doing any sugar supplementation, which in this case, of course, is not a usual dietary supplementation as we usually perceive. In this case, it's more like a therapy, or it's like a therapy, because we are giving the sugar that's missing in order to push the building of these glycans. But very few really had any experience or had ever taken any of these sugars. So it's really difficult to actually have a concrete overview of the effect of these therapies on these patients. What we can really say is that still very few patients have done or have taken these sugar supplements.
At the same time, it will be interesting if by any reason you know any case where from with other supplementations you have observed an improvement or and also the opposite, right? Any alteration of the function, it will be interesting to know.
Yeah.
Yes.
I think that's difficult to evaluate because you give it probably for a long time to have conclusions or to make conclusions about that.
Mm-hmm.
And it's not such an easy task to take a certain sugar for a very long time.
Yes.
But the one thing is for certain, we have been receiving lots of requests and doubts from many CDG families about nutrition. So that's something that we can actually highlight. So families are concerned about nutrition and want to make sure that their children, so that CDG patients are receiving the best nutrition possible. And it's definitely a topic of interest that probably needs to be further explored. So metabolic nutritionists out there, please get interested in CDG.
Okay, so
also, Rita, if I may hear Vanessa, can you listen?
Hello, Vanessa.
Yes.
Hi, hello. So just to highlight on what Rita was saying, we are actually about to launch a survey where the nutrition management will be one important part. So we want to take advantage to all of you that are attending today the virtual cafe to let you know that this survey will be launched around the end of November, beginning of December. And nutrition and also the priority symptoms from the eyes of the families to be treated are the main topic on this survey. So there are more questions in the chat. Maybe Carlota, you can continue. Maybe you can, I know we already talked about vaccination, so maybe we can go to the fourth question from the group of Brazil families. Can you please translate it and share it?
Yes, so the question it's really about the CDG and COVID, and here I would basically suggest that we would share about the webinar that was already recorded, that was given by Dr. Andrew on the topic. Rita, I think you can have maybe a summary on what was discussed in that webinar. I don't know.
And also to check on our section in the World CDG Organization website, we have a section dedicated to COVID. And also we have posted the video from Dr. Andrew Edmondson from US.
You could share the link here through the chat.
Yes.
Yes, I think
Can you share, please, Paula?
Yes.
Okay, so the next question related also with immunology is about what is the protocol in case of a CDG patient gets hospitalized with an infectious, infectious or immunological issues. Is there any protocol? Is there a better way to approach it?
At least as far as I know, there are no emergency protocols for any CDG type.
No,
I mean, right? No.
right. No, I don't know.
Yes.
I think the most general advice that we have in terms of the care and management of any clinical manifestation in CDG are really the ones contained in the clinical management guidelines. I don't know if then there are some institution-specific protocols, but we have not been made aware of those.
Yeah, and it would also depend on what kind of picture does the patient have, right? So there are such a variety of immune issues.
Yes, exactly.
So here is a very good question from Tia, which is in a case of MOGS, but well, in MOGS CDG, but let's make it a bit more general. If you have a patient with CDG with low levels of immunoglobulins, specifically here, immunoglobulin G, if you have low levels of those, even though there are no cases of severe infection or there is like a good vaccination response, is there a reason to start on immunoglobulin infusions?
That's a difficult question.
Yeah. Like,
I would leave that for the decision of the clinicians that are following your child.
Yeah, it has to be studied case by case, I think.
yeah.
Because the low levels of immunoglobulins, they could be sufficient somehow. The levels that you mentioned could be eventually be protective enough, so far at least.
Yes, some patients may be not need high levels or can even, I would say, have no infections but relatively low levels.
Mm-hmm. Yeah. So here's another question about vaccination, specifically the flu immunization. If it's normal that sometimes the kids developed a rash, and if people would need to titer, so measure the vaccine response every year, or maybe like in case if it was responded well once, would it be again to measure every year?
If there is a rash, and then I didn't understand.
Sorry. So if the kids take the flu vaccine every year, would they need to measure the response every year, or is it like enough to measure the response once, and if they respond well?
I think if the first time the response is okay, I would not repeat this until there are some problems, but I would not repeat it if the first time the levels are okay.
Yeah. Okay, so this is the same question. This one was already covered in a presentation. About immunology. So here's a good question. Are there some experience on the study of the paper? Are there some experience on the study of the paper of the intestinal microbiome and immunological disturbers in TDG?
As far as I know, there are still no studies on the intestinal microbiome of patients with CDG.
Not in my knowledge.
Not, yes.
That was something that we suggested that should be done, but as far as we know, it hasn't been started.
Yeah. Okay, so I think we are approaching the end of the time. I don't know if you want, if we should close the questions and then answer them after the coffee. What do you think? Yeah. So,
Yes.
sorry, Rita, continue.
No, go ahead. Go ahead.
Yeah, so just to let you know that don't worry, because all the questions we'll be taking them in consideration and then get back to you on a nice document with the questions and publish them on the World CDG Organization website. And now we are also going to just launch a small questions for you to answer related with this virtual coffee. So I don't know if you can see the first question on your screen. You should be able to see it now, and you can start answering them. So the question is, what are the main concerns regarding the immune-related manifestations?
And just to reinforce what Carlotta was saying, we are going to answer all of the questions, and we are going to produce frequently asked question document, similar to the one we have done for the COVID pandemic related doubts. And again, we are recording this webinar. The PowerPoint is going to be made available. And also, we are going to produce some sort of kit, let's call it that, where we are going to have the main papers about immunological involvement in CDG, and also some guidelines in lay language for families, where we are going to include the answers to your questions. And then call for CDG professionals and association representatives. If you have any interesting topic or project that you would like to share with the community, please do send us an email. We are really happy to give you the floor and to have you take over our next CDG virtual coffee.
So I have 65% of people that voted. Maybe I will just share the results quickly. So the main, as you can see, the main concern are infections, but there are some other concerns, right? Mm-hmm. So moving on to the second question, which is, what other topics would you like to be discussed in upcoming editions? And if the topic that you would like to see covered is not here, you can also choose here other and specify the topic in the chat, because we also take those into consideration. Okay, so I don't see any more votes coming in. I've sent 70% now. I don't know if there are any people that want to share. Okay, I don't see anything, so I will just share for a bit. So the main topic here would be to cover next seizures and stroke-like. I can understand why, definitely. So we'll keep that in mind. And the last question about the webinar is, how useful was this for CDG coffee?
And we can take criticism, okay?
Yeah.
So please be truthful. And of course, there is always room for improvement, and this was the first
Yeah,
one.
definitely. Okay, I have 70% responses. I think we are good to go. So it was very useful, the webinar. So we are going to keep sure that we keep those coming. And but please feel free to tell us what is there to be improved, and we will be happy to cover it. And thank you, Rita, so much for presenting, and Professor Jack and Paula.
Thank you very much, Rita.
Thank you. And just to remind you, this is going to be a monthly event. So we are going to try to make sure that the next topic is going to be seizures and stroke-like episodes. And thank you everyone for being here and for attending.
Also, Rita, just in the chat, there are 2 topics that came out as well: eyes involvement in CDG and gastrointestinal. Okay, so we can also add it to our list of topics.
Yeah.
Okay, and just recall everybody, we need help always. So anybody that is willing to translate or to help us translating the materials coming from today's webinar, we really acknowledge. Just to write me or send us an email. And again, thanks to all that helped in the research of Rita since the beginning. We felt your support since 5 years ago, and thanks so much on behalf of all team. Thanks, Jack and Paula as well, and Rita. Congrats.
Thank you.
Thank you. Bye bye.
It's been a pleasure.
Bye.
Thank you,
Bye.
Rita, and all
Thank
team.
you. Bye bye.
Bye.